So my special guest today is a friend of the show, and he specialises in helping people who have anxiety disorders. He's a psychologist for the Anxiety and Stress Reduction Centre of Seattle. Dr. Travis Osborne, welcome to the show.
Hi, thanks for having me back.
So today we are going to talk about what you call generalized anxiety disorder. And people might be listening saying, oh my goodness, what on earth is that?
Yeah.
So tell us a bit about what generalized anxiety disorder actually is.
Yeah, so generalized anxiety disorder is the specific anxiety disorder that's designated basically for people who worry. And so it's kind of a fancy term for chronic and excessive worry. And so what we know about people with generalized anxiety disorder, or GAD for short, is that these are people who really have a level of anxiety and worry that's much higher than what kind of, let's say, the typical worries that most of us would have. And we consider it to reach the level of an anxiety disorder when someone's worried really more days than not for at least 6 months in a row, and that they're experiencing a whole host of other symptoms in addition to that worry.
So what kind of symptoms? Give us an idea of the most common symptoms.
Yeah, so there's 6 main symptoms that tend to show up with worry. Those include everything from just feeling a lot of physical tension in the body or feeling very kind of keyed up. Sleep difficulties are very common. Usually this looks the form of difficulties falling asleep because the person has a hard time kind of turning off their mind at night and doing a lot of worrying, laying in bed, or waking up kind of in the middle of the night or very early in the morning. And again, their mind just kind of starts going with the worries and they can't fall back asleep. So sleep difficulties are very common. Irritability is a big one. When we're all anxious and stressed, it's much more easy to get more irritated and irritable more easily. So that's a very common symptom. Difficulties concentrating and focusing is a really important one. Worry can be so interfering and distracting that people can really have a hard time just focusing on the tasks that they need to do to kind of get through day-to-day life. So concentration or attention difficulties are important. And because of all that, being really easily fatigued or tired is also another common symptom. If you're not sleeping well, if you're really keyed up and tense and irritable, can really kind of wear you out. And that can also just lead to this more general feeling of restlessness. So of those 6 symptoms, in order for someone to get a diagnosis of GAD, they need to have at least 3 of those 6 present more days than not for that same 6-month period of time where they're having a lot of worried thoughts.
And would some of those symptoms include lights of panic as well, feelings of panic, being out of control, chest breathing, kind of short breath?
Yep, so people with GAD can experience panic attacks. Not everybody does, which is why it's not a symptom that you have to meet criteria for the disorder. But certainly many people with GAD do experience panic attacks. And what that usually looks like is during periods of really heightened worry or really excessive anxiety. It could reach that threshold where people start to actually have a panic attack, where they're having the symptoms you described, like really rapid heart rate, increased breathing, tightness in their chest, all those kinds of things.
So what kind of people are likely to experience GAD at some point in their life?
Yeah. Well, interestingly, GAD is a disorder that actually affects women more than men. So we know that about twice as many women are diagnosed with GAD than men. It's also a disorder that tends to start a little bit later than some of the other anxiety disorders. So we know that it actually peaks in the population kind of in middle adulthood, and the average age of onset is actually closer to 30, which is a lot later than a lot of other forms of anxiety. We know that people of European background are much more likely to get GAD than people of non-European background. And that kind of big picture, close to about 10% of people will have GAD at some point in their life, so close to 1 in 10. So it's actually a very common type of anxiety.
And how do you distinguish, because we all have day-to-day worries, things like economic situation, job situation perhaps, that kind of thing. So how do you distinguish between having what you might call generalized anxiety disorder from just being kind of normally worried?
Yeah, you're absolutely right. Worry and stress and anxiety are just a very normal part of being alive. There's a few different criteria that we use to kind of tell the difference between normal worry and what might be GAD. For starters, normal worry tends to kind of come and go. It tends to be linked to maybe specific that are going on in somebody's life. So let's say somebody has a stressful exam coming up, or a big project at work, or maybe is getting married, or just lost their job. They might have a period of, say, a few days or a few weeks of kind of heightened stress or worry about that. But then when the event's over, the worry kind of goes away, and they kind of go back to like their usual, how they usually feel. So that's one thing. With GAD, we don't really see people returning to a state that's relatively calm for much of a period of time. So they might be very worried about those stressful events that are happening, but then worried about all kinds of other things. So where they're just feeling this elevated level of anxiety and worry, kind of oftentimes most of the day, and then many days and weeks and a month. Another thing that we look at is how controllable the worry is. So for normal worries, most of us can get bothered by something, but then if we get distracted by like watching TV or talking to a friend, we can kind of put those worries in the background a little bit. And for people with GAD, that's extremely difficult to do. The worry is kind of front and center. It's very difficult to control. It's very difficult to put aside. And so because of that, it really impacts daily living. People can have a hard time, just concentrating to get through the day. A hard time getting things done that they need to get done. Whereas normal worries don't tend to interfere with life quite so much.
And so I'm guessing that some people may worry about lots of different things, and others may worry about maybe the same thing over and over.
Yeah. There's kind of these two patterns that we see with excessive worries. That some individuals, the worry really focuses on maybe one or two things. Like maybe most of their worry is about finances or economics, or maybe most of their worry is about their job. And really that might be like 90% of what they worry about. Other people have a pattern of worry that really is about everything, and maybe as they move through the day, their worry is just hopping from topic to topic. So I'm running late for this meeting, and I'm really worried about that, and then I get to the meeting, and all of a sudden I'm extremely worried about how I'm going to perform in that meeting, and then I leave the meeting, and now I'm worrying about what I'm going to be doing tomorrow, and the worry is just kind of skipping around a lot. That kind of worry, I think, is actually a little bit more challenging for people to get a handle on, because it's this constant moving target. But the way we approach, treating them is relatively similar.
And what do people do that's kind of, if we've talked about it before, kind of falling into a trap? You think you're helping yourself by doing certain things, but you're actually making the situation worse. So yeah. What characteristically do people do to try and make the situation better, to try and, if you like, worry less?
Yeah, I'd say there's two big things that people do that really backfire. The first is procrastination and avoiding. So when people are very worried, particularly about maybe something that's coming up that they could actually do something about to make it go more successfully or to feel better, they will just sort of put off working on it. So a classic example would be somebody who's extremely worried about maybe an upcoming exam in school. They just sort of avoid, opening the book. They kind of avoid studying for it, because every time they start to study, the worry just really gets very intense and they start to get very anxious. So they just kind of put it off. Unfortunately, that procrastination and avoidance usually leads to more anxiety over time, because then the amount of time the person has to prepare for whatever the situation is just keeps shrinking, and their anxiety just keeps rising. So it really only gives them some temporary relief. Another big trap that people fall into is kind of the opposite of that, which is many worriers kind of over-prepare for things. So these would be the people that start studying for the exam like 6 weeks in advance, and they spend way more time and energy than is needed to prepare. They're kind of over-preparing. And the act of doing that over and over again actually kind of elevates their anxiety, because they feel like they need to be doing something almost all the time to be preparing. So both of those things can really backfire for people.
And can generalized anxiety over time, can that lead to other anxiety disorders, or does it just kind of keep going in a cycle?
It tends to kind of keep going in a cycle. One of the things that it actually tends to lead to, even more than other types of anxiety, is actually depression. This state of living in this really chronic, worried, and anxious state can cause a pretty large number of people with GAD to become quite depressed, and to feel pretty low and kind of dissatisfied with the state of their life, because they're so preoccupied all the time that they really can't enjoy kind of living day to day. So depression actually ends up being something that is very common outgrowth of GAD when it goes untreated.
And what are the treatments? Are there any, I know we talked before about different medications and things, but are there any kind of supplements, like health supplements, vitamins, anything like that people could take for their general health, which could help in that?
I think in general, not really that's been studied that well. I mean, I think of anything, one thing that might assist would be things that help with sleep, particularly because if someone is really chronically sleep deprived and has a lot of worry, that just really makes the worry much worse. So sometimes that could actually be a sleep medication that's prescribed, by a doctor, but it could also be other kind of more over-the-counter things that kind of help with sleep would be, I'd say, probably the biggest thing that could assist. Aside from that, the same medications that we've talked about before, the Ssri medications, would be the main medication for this type of anxiety. And the good thing about that, too, is the same medications also help for depression. And so for people that have both GAD and depression, that same medication can be effective for both, which can be really helpful.
So that's the medication side. Is there any kind of practical things that people can do on a daily basis to help to deal with it, and I guess in a way retrain themselves, because I guess it becomes such a habit that it just cycles over and over and over again?
Yeah, you're exactly right. People who chronically worry, it really does become this cycle of kind of getting caught in these worry episodes. And so the treatment that we know works the best is a type of cognitive behavior therapy that's been developed specifically for GAD, and it includes a number of different strategies. I'd say the first and foremost is a strategy called cognitive restructuring, which is just a fancy way for saying challenging your thinking. So we know people that worry tend to do two things. They tend to overestimate the likelihood that bad things are going to happen. And then they tend to envision that those bad things are going to be quite bad. So we call that catastrophizing. And so an example might be, let's say someone's getting behind on a project at work. They might jump to the conclusion that they're going to get fired, and that after getting fired, they're going to be kind of destitute and homeless. And so it goes from, a normal situation we all experience, which maybe we're just a little bit behind, to imagining this really awful and intense catastrophic event. Well, anyone who's got that going through their mind is going to feel incredibly anxious, incredibly scared. And so the first strategy we would work on is helping people look at that thinking and start to look at, well, how likely is it that just being a little bit behind on a project is going to lead to you getting fired? What are other outcomes that could happen? You could get caught up. You could get some help. Maybe you are a little bit late, but your boss is, somewhat understanding, or even if they aren't, maybe puts you on a performance plan instead of firing you. Really helping the person look at all the possible things that could happen and then figuring out which are the most likely. And then to help with the catastrophizing, what we do is we have people think, well, let's say the worst case does happen. Let's say you are fired. What would you actually do? How would you actually cope with that situation? What would be the plan that you would come up with? What that allows people to do is realize that the catastrophes that they usually think are going to happen probably won't, because if someone is fired, they're not likely to just stand by until they lose their house and lose, everything and become homeless. They'd probably do a whole number of things to help solve the problem. So that challenging kind of what's the realistic odds of that outcome and how would you cope with the worst case scenario are really powerful interventions.
And what about other kind of interventions? I'm guessing that relaxation must be a very important one.
It's a really important one because when people are chronically worried and stressed, they tend to start carrying a lot of tension in their bodies. Most people will notice that kind of in their shoulders and their necks. Sometimes they're getting headaches from stress, but other people will experience it all over their bodies. So there's a type of relaxation strategy called progressive muscle relaxation, which we tend to use a lot with people with GAD. What that involves is kind of systematically learning how to tense and relax all the major muscle groups of the body. And what this strategy does is two things. It helps people identify what does tension feel like in different parts of my body, and that's what the tension part is designed to do. And then the relaxation part is designed to help people learn how to quickly kind of let go of tension in different parts of the body so that they can maybe prevent that escalation of tension and stress that can happen. Progressive muscle relaxation, or PMR, is something that people can certainly do on their own. If you just sort of look that up online, you can actually see many examples of kind of how to follow along and do that. There's probably also recordings online that you can listen to that kind of coach you through it. But it's something that requires a lot of practice. So I usually recommend that people practice it daily if they can. Because if they do, they will get very good at relaxing their bodies very quickly. That can be a really effective strategy.
And we were talking, about how people's worries are kind of catastrophized in the worst case scenario. Is there any kind of strategies in there to help them really get to grips with making it more realistic?
Yeah. So one of the things we know is that people can spend so much time worrying that they don't actually spend time solving problems. So a good example that I mentioned earlier is instead of studying for the exam that you're worried for, you're just avoiding it and kind of putting it off. And in the meantime, the problem's getting worse. So if that's the case, we spend a lot of time teaching people a series of skills, how to solve a problem, break it down into steps, and actually then approach it and start implementing solutions. How to more effectively manage time and set priorities. Worry has a funny way of interfering with our sense of what's important. So we might have 6 things in front of us that need to get done, but we're super worried about something that's, way off in the future. And so we spend all of our focus and attention on that and not on solving the problems that are right in front of us. So helping people learn how to prioritize what's truly important, not just what their anxiety is telling them is important, and then how to break a problem down into pieces and start working on some piece of the problem can often alleviate anxiety significantly. And I've had a lot of people that I've worked with just using those strategies alone, starting to actually attack and solve the problems in their life, actually removes a lot of the triggers for what they are worried about. So it can be very effective.
And a lot of generalized anxiety can manifest in kind of physical symptoms as well. And I think, that can alarm people even more. Is there anything else that you can recommend for people really being able to get used to those kind of feelings to a point where they don't bother them so much anymore?
Well, the first thing I always think is important is that people actually go talk to their GP if they're noticing lots of those physical symptoms, because sometimes they're just anxiety, and GP is usually pretty good at helping people sort that out. Other times they may be actual other physical symptoms that actually need attention. So health is interestingly a big area of worry for people with GAD, and oftentimes it is because they're feeling these various kind of signs and signals in their body that something might be wrong. So I think always checking that out with one's GP and making sure that that's the case. The other thing is that there are some physical illnesses that can kind of mimic anxiety. So certain problems with thyroid and some other things that kind of mask or mimic the signs of anxiety is always good to get kind of checked out. But another strategy that's increasingly being used is mindfulness skills. And so mindfulness essentially is the practice of being present in the current moment and attending to whatever is kind of right in front of you. And if you think about what worry is usually either spending a lot of time envisioning the future or sometimes worrying about things from the past, but it is rarely does it involve focusing on the present. So the practice of mindfulness can actually help people become comfortable with those physical sensations like you were mentioning, just practicing paying attention to those sensations, kind of sitting with those sensations and not trying to escape them, and also just watching them change, seeing how they maybe escalate as my thinking escalates and how they de-escalate as my body becomes calm, is a way for people to start understanding how their bodies are reacting and to get more comfortable with them. So mindfulness is increasingly being used to treat worry and GAD to help people stay in the current moment as opposed to in the future or the past.
And I'm guessing that would work the same for the thoughts, because people then can start to recognize that they go in a kind of cycle of thoughts and it's probably the same 4 or 5 thoughts round and round over and over again, but when they're in it, they don't realize that.
Yeah, mindfulness of thoughts is a really important part of that exercise, which is literally just kind of watching what your mind does. And one of the kind of metaphors that we'll use with people is kind of like imagine kind of watching the sky and seeing clouds kind of pass by you in the sky and learning to observe your thoughts in that way. So just kind of watching them and observing them instead of reacting to them. And what people find is exactly what you just said, that they start to see these kind of repetitive patterns in the way that they think or in the way that they quickly jump to kind of worst case solutions. And just even being able to take that step back and observe one's own thinking and see it in a different light can help them start to disconnect a little bit from those scary thoughts and control their anxiety more effectively.
So there's lots of things there that people can actually do themselves to make a difference. And I think that's the key, isn't it? That people can actually take steps themselves to take that control from that worry.
Absolutely. And I think, just as with all other types of anxiety, it's always good to sort of start with these strategies yourself first. And if you've really spent a lot of time practicing them and you've spent a lot of time really kind of doing the work of trying to do this kind of self-help work, and it's not working, then that's the time again to sort of talk to your GP or to maybe find a therapist who works with anxiety. But before even doing that, there's a whole lot of things people can try to get control of their anxiety first.
Fantastic. Well, hopefully people will be able to do that now and take what you've said and be able to make a big difference to their lives. Now, you're going to be back on the show very soon, and we're going to be talking about social anxiety.
That's correct, yeah.
Fantastic. So we'll be getting ready for that. But in the meantime, Dr. Travis Osborne, thank you very much.
Thank you.